folks, it's that time, and I'm sitting in for Mary Ann today. Mary Ann is not feeling all that well today, so I'm going to be chairing the meeting today. So here we are at 2 o'clock, and so I'm going to call us together. First thing I'd like to do is we take our roll. So Dr. Copeland, okay. Danielle Angelari.
She's on a phone call, but she's here.
Okay. Dr. Bill Gorski.
Here.
Okay. Dr. Terry Giordano.
You know, Dick, those Swedish names are always hard to pronounce.
I know.
Here.
Yeah, all right, and Tim Neighbors. Okay. Linda Sandquist.
Yes, present.
Okay. And is our advisor Wendy Larson.
Here I am.
Okay. And Jay Ware, he's not with us today. Okay. All right. So, and I see that yes, Danielle is here. All right. So then let's, Jason, do we have anybody who signed up for public comment?
No, we do not.
Okay. So action items that we have today. I would like the minutes of last month's meeting. Do I have a motion for the minutes to be accepted?
Motion.
Second.
All right, Dr. Gorski seconds it. All in, well, I have to go down the row. Richard Kunnert, yes. Danielle, no, is not available yet. Dr. Gorski?
Yes.
Dr. Giardini?
Yes.
And Linda?
Yes.
Okay. All right.
If we could pause for a second, Wendy, I don't know if you know the answer to this, but Danielle makes the fifth person, which is the quorum. So if she's not available to vote at this moment, I don't know that we meet the quorum at this point in time.
You're correct. What I'm going to do is text her and say, can you just put up a thumb if you approve the minutes? Because I think that would suffice. If I could type, it would be better. Okay, let's see if she responds. Sorry. Hello? Okay, it'll be a little bit, but I'll be there shortly. Bye-bye. Sorry. So maybe we need to delay this vote till Danielle can get on the phone or indicate something.
Okay.
Can we potentially go to discussion items and come back to the action items?
Good,
All right.
good.
Let's
Yeah.
do that. We can do that.
Okay.
So we're dropping down, folks, to E, and that's the FY22 budget and work plan preparation.
Okay, I'll try to make a nice lengthy speech here to give Danielle a little bit of time. So essentially, if you And believe it or not, we're already coming up on a year of, it's been more than a year that you all have been board members, but it's coming up on a year of our, since we started our fiscal year budget and activities. So we will need to, I think it was Tim's recommendation when I last spoke to him that we submit a budget and work plan to the county in August rather than waiting until September, so we're not kind of up against it. So really with our August meeting being the first week of August, that activity needs to be happening over the next 3 to 4 weeks. I would like to also use this as an opportunity to do some type of informal annual review with each of the board members, just to get an idea of the things that you feel have been working really well, any areas that we can improve, and take that feedback into consideration for the development of the next fiscal year work plan. And then based on what the work plan dictates, identify a budget that would be appropriate for operating that work plan. So essentially, just wanted to let everyone know we can schedule those in person this year if you'd like to come down to the office or meet somewhere. I'm also happy to jump on a phone call or Zoom with each of you over the next month to gain that feedback and prepare something for the August board meeting.
That sounds like a good plan.
Agree.
And if Danielle did type her response that she approved the minutes.
Right. Right. We have approval for the minutes. Okay. What further discussion, Jason, would you recommend we have here? Because I agree with that it's with Wendy that it's sounds like a good plan.
No other discussion from my end if there's any questions or feedback.
Okay.
I was just wondering, will we have any awareness of what the total revenue will be available this cycle? Any rough feeling about that or a more exact feeling about that?
Yeah, so there was actually some changes that took place January 1st based on the changes to the way sales tax are done, where it now tracks directly to an IP address. So if you're doing an online purchase in Winnebago County from a computer in Winnebago County, you'll be paying sales tax in Winnebago County. So there was a increase in sales tax revenue beginning January 1st. And, you know, without having the exact figure right in front of me, I have been tracking the months that have come in. I think there's 4 months that have already come in for January that have been collected and reported by the state of Illinois. And I believe it was on track for about just over 14 million total for the year, between 14 and 15 million if my memory is correct on that. But I can certainly provide those projections and certainly in advance of the budget, because we will need those figures for determining the professional services. So I appreciate the reminder on that. That's something I'll send out.
Bless you.
Thank you.
Right. Okay.
Thanks, Jason.
Okay. What a nice number.
Yeah.
So
No kidding.
that's exciting to think about. Okay. All right. We still are waiting for Danielle. But Jason, would you please then take us to action number 2, which is fiscal year 21-22 program special conditions that have been met.
Sure. So on a monthly basis, we'll be providing a report of special conditions that have been met or are being recommended to be considered as being met by the funded programs. So for each one of their work plans that were developed for them, I should say, and that they agreed to, each funded program had at least one special condition that dictated, in addition to what they had proposed in their grant application some other requirement that the mental health board was dictating as a condition of them being funded. And so some of them were very simple, such as provide they might have referenced staff that was being hired, but they didn't provide the specific full-time equivalency of that staff person. So we dictated that they needed to provide that prior to being funded. Some of them.
I'm sorry.
Okay.
Okay.
Um,
So would you then just very quickly take us through this?
Yeah, so I would say that really there are two that stand out aside from being, as I mentioned, some very nominal things like providing the additional information about the full-time equivalency of a position. The two that stand out as maybe having a little bit more consequence to them would be the University of Illinois College of Medicine requirement that they have an MOU with the jail for the warm handoff program, in which they will be providing re-entry mental health services, for people coming out of jail. And so that one, recommending that that condition be considered as met, even though they do not have a formal MOU document. And the reason that I believe, and in discussion with Mary Ann, that she was in agreement with this, was that the jail actually, when they issued their RFP for their mental health services as part of their funded award, they included in that the requirement that whoever got that contract would make referrals as deemed appropriate, as clinically appropriate, to the University of Illinois College of Medicine program. And because they have an open RFP, they are not legally able to, at this time, provide an MOU to another provider who could potentially apply for that service. So they're kind of, at this moment in time, not able legally to get an MOU, but the essence or the intent of that there be coordination and collaboration between the two, is dictated by the RFP from the jail. The second, any questions on that, first of all, before I move on?
Jason, are you suggesting removing that then as a special condition?
That be considered that it is met, yes, that the equivalent of an MOU is.
Okay.
All right. That's pretty much close to what I was going to say too. So they can do this without any harm to what they've asked for in monies. That's not going to cause any harm or any breach of contract.
The only consideration was, part of the scope of their work was to provide a warm handoff, and a warm handoff essentially would mean that contact be established prior to discharge from the jail. I'll just say, I think there's a willingness to make that work. Part of the complication, Wendy, you could probably speak to this, in attending some of those sequential intercept modeling planning groups, is that sometimes those discharges happen really quickly and without much notice. So,
someone could be in court at 1 o'clock or 1:30 and be out an hour later. So they sort of need better, really sharp staffing.
We did a tour of the jail yesterday, and one of the things they noted about their program was, because of that sometimes unexpected discharge or release from the jail, that they really hoped to start the discharge planning much earlier in the process, when they're working with people, even at that initial assessment, to already be identifying what some of those needs are for reentry, especially when there are crimes that hold like a lower offense crime where there's probably some reasonable degree of expectation that it'll be a short period of time in jail, that they start coordinating that discharge planning much earlier or being intentional and thinking about it. So with it being dictated in the RFP from the jail, that one of those services that would be available for the referrals would be this UIC program. I would say it's likely that those warm handoffs would be made available, but I don't know that I would say that, you know, that it in every case is going to necessarily be able to happen.
So is that the worst case scenario, Jason, of the, so I'm trying to think through, well, worst case, what is the worst thing that could happen if this special condition is considered to be met and there's no further formality to it? Could there be harm at some point, or could there be things falling through the cracks? People?
I think that the referrals are still dictated and mandated. So the worst case scenario would be, rather than a warm handoff, there would be a soft handoff, in which case the person is referred to go to a service provider, rather than the service provider having that overlap where they actually come to the jail.
Okay.
And meet the person before they're released.
So one of the things that is happening, I think you have to consider what's going on in the jail in light of some of the new legislation that has come down the pike about Illinois moving towards a cashless bail system. And in fact, Winnebago County, for low-level crimes, already essentially having a cashless bail system. This is going to be for the service providers to develop a rapid response. So someone is brought into the jail for, let's say, a disorderly conduct. They are held overnight till they have an appearance in front of the judge, and then they're released. So in that 18 to 24-hour period, the service providers are going to have to identify and connect with people. But I don't think that system exists yet. But there are probably some obligations for people to report to the pretrial services unit. So there are other opportunities where U of I could make that contact. But I think the providers are going to have to puzzle it out while this is evolving. That's my thought.
So maybe that would be one of the metrics. I'm sorry, Dick.
No, Bill, I'm delighted you're asking about this, because I think, personally, I think this is a program that is really needed for us to start getting into aftercare and get in case management, and somebody to follow these people so that we can stop the recidivism.
Yeah, Dick has it. That's right.
Let me just finish with this, Wendy. Yesterday, personally, was a hard day. That tour of the jail, we have to understand that the jail is 40 positions under. And the jail was put together with a design that was supposed to be relational. So when the women's mental health unit, everybody, ladies were in their cells. And for me, like watching people be in quiet rooms that we used to have at Singer. And that was something that you didn't want to do, and you wanted to make sure it wasn't very long. And because again, when there's shortages of staff within the jail, lockdown is no other option. That's one of the reasons they're asking us for cameras, because they want to make sure that they have some method to be people visible. And so I think this after piece with the medical school and also with Crusader become really, really, really important to us, and make sure that people get continuity of care, that something's good is happening to them after they leave. Because again, one of the things that the police about, or the corrections staff talked about, and I think they're trying to do as really as well as they possibly can. And believe me, I understand what that means from an institutional point of view. But there, it's we don't want people, number one. I see all the more reason why we don't want people, number one, to go in. But number two, if they are in, then we really want to have something good happen to them on the way out, so that they're getting what they need and getting support, getting tied into something. And so I think watching this and making sure that the medical school is doing what it is that they say they dream of doing becomes really important.
Well, Dick, what I was going to say trails on that, because I was thinking if this is accepted as met, maybe there's an ongoing metric or a piece of data that we choose to measure to ensure what you just said. So maybe a specialized measurement about the handoff occurring, or are there circumstances where it didn't occur in a timely enough fashion?
Yeah.
Maybe that's one of the ways, and maybe that applies to other special conditions if any of them are a little squishier that we choose to agree is met, but we're going to figure out a way to follow up on them with our report outs, whatever is, I don't know, is it going to be quarterly, Jason, or twice a year, or whatever it is? It probably should be tracked.
Yeah.
Well, I think part of the crisis response is looking at, and this is where the strategic intercept model, I think personally, will come in, is the police departments are going to be tracking the interactions the crisis response team has with individuals, and then where they end up. Do they end up at Rosecrance in substance abuse treatment? Do they end up in a mental health bed? Or do they end up in jail? These are the tracking things. And I think that will play into what we're doing. And I hope that U of I will expand into that over time too, so that we have not just the immediate crisis response, but then that warm handoff that we are talking about from the jail, from other places as well. So maybe a warm handoff at the emergency room, after someone's stabilized, then U of I could step in, or some other party. But at the moment, the jail is sort of our starting point. But I think those crisis response teams will give us that data, is my thought.
So if I could just clarify a couple of the questions that are asked. The outcomes are required on a quarterly basis. For the College of Medicine's work plan, it is dictated, one of their outcomes that they'll be tracking is the number and the overall percentage of the whole of those who are warm handoff clients to them versus clients that they serve that were not done through a warm handoff. So that's already being dictated, that they measure that. So we will have a way of monitoring that on a quarterly basis to see if it's at 10%, we may find that that's not acceptable versus a higher percentage. And that the other part of that is that, in addition to just the collaboration between these two entities, that all 15 funded programs are required to participate in these quarterly network meetings, in which one of the goals of that will be to talk about the ways that coordination can happen, and that there can be these kind of more warm handoff referrals throughout the entire ecosystem of mental health services, not just within these two programs.
And I think that's a huge dimension of what it is that we all dream about for this board, is having those meetings and encouraging cooperation and collaboration and between all these agencies, that they be supportive of one another.
Agreed.
So if I may move to the next special condition that I'd like to highlight, and then we can, you can discuss if you'd like to vote, or I assume you could pull one out if you wanted to vote on the rest, and pull one out for a separate vote. The other, I think that's worth noting, would be two special conditions within the Winnebago County Sheriff's Office Jail Enhanced Programming proposal. Special condition number 2, which dictated that the Mental Health Board be offered the opportunity to review the RFP for jail services before that was sent out. And they did offer us the opportunity. We reviewed that. Dick and Marianne both offered feedback on that directly. And the RFP directly references the Mental Health Board's strategic plan, mission, vision, values, and dictates that whoever is awarded that contract agree to operate within the within alignment to our plan and our values. So in addition to dictating those referrals to the UIC program, there was that specific requirement to adhere to the Mental Health Board's strategic plan. And secondly, and probably in some ways the one that carries the most weight, was the special condition that prior to the jail being able to purchase the suicide mitigation equipment that they were requesting, which included some cameras, that there be a development of a plan that be put together in coordination with the Mental Health Board. I'll just say that I feel like the staff at the jail and Sergeant Pont in particular have really gone above and beyond with this particular request, providing us with research, providing us with a kind of summary of the jail's current procedures, providing statistics that show the monthly census for the suicide watch cells, and then also offering for a tour of the jail, which I'll tell you happened yesterday and lasted 2 hours with Dick, Terry, Jay Ware, myself, and 2 of my staff. We really went through it, I think, with quite some level of detail through the different parts of the jail, really understood the procedures. I can offer as additional context that if you look at the data, there are some months where the actual number of segregations in Suicide Watch exceed the current camera capacity. That doesn't mean at any point in time that's happening, but because that's not a daily census, that's a monthly census. But you can definitely see that there's moments in time where they're approaching their capacity, and they really don't have any type of backup plan for that. They can't double up people in the same suicide watch cell. They can't refer them out to Rosecrans. I mean, there's no backup plan for that other than to bring somebody in and to assess all of the people who are currently on and to try to find who's the lowest risk to put them back into the general population. So those new cameras that are being, and the new equipment in general, each camera directly creates one additional suicide watch cell. So essentially my understanding was basically be opening up another, they call it not a cell, but a pod, right? A new mental health pod that will have suicide watch cells. I think, I don't know if there's 20 to a pod. I can't remember the exact number, but there's probably always more data that we could try to get or try to collect to analyze this. But I think that, again, if we're looking at intent and we're looking at best practice, I think the intent was met. I think they've gone above and beyond with providing us information and giving us access in a very timely fashion. And so I have listed that as a special condition to recommend that that special condition be met, which ultimately just then gives the green light for them to purchase their suicide mitigation equipment that they've requested.
So I'm going to ask then, if unless there are other questions and discussion, I'm going to ask for the board's approval of these conditions that that you're in agreement with what Jason has outlined, and that what we have now in our agreements with our grantees. So could I have a motion to that effect?
Motion.
Terry? All right. Second? Anyone?
I'll second it.
Okay, thank you, Linda. Any discussion before taking? Yeah, Bill?
Dick, just one. Jason, is there any understanding of a due date where we will want these to be met satisfactorily by a certain date?
Yeah, each special condition noted either a due date or a condition that something, a contingency, right? So for this particular one, what was noted was that they would not be able to purchase the suicide mitigation equipment until the plan had been developed and that there was approval of their plan by the mental health board. Others dictate a specific date, such as by end of the program year or by the 6-month point, depending on what type of thing. So for example, some of the special conditions required develop a specific tool for a certain measurement that they reported that they would track. And for something like that, the due dates were generally by the first quarterly report.
Okay, got it.
That 3-month mark. Others were just open-ended. Before you can receive funding, you must meet this special condition.
Can I add something just before we vote on all this? Those of you who might want to take a tour of the jail, I highly recommend it. I think Dick and Jay, and Dick, you can correct me. I think a lot of eyes were opened yesterday, especially with Jay. Seeing it firsthand, exactly what goes on in there. I think Jay made the comment more than once, I couldn't do this job. And he wasn't meaning that in the meaning way, in a respectful way. To see things from that perspective was really, I think, eye-opening for a lot of people yesterday. So I would encourage it. If you like to go, I'm sure those arrangements can be made where you can see it and see it firsthand. Other than, I mean, talk is cheap. Talk is cheap. We can talk this all to death, but seeing it, how it's actually done, I think, Dick, you made a good point. You know, how some of those, you know, isolation is not what they really want to do, but what they have to do. I think you made a good point on that. And that's my 2 cents.
Okay, all right. So, let's just do the round here for, so all in favor of accepting, you know, these conditions for our grants. Bill, yay or nay?
Aye.
Okay. Linda?
Yes.
Okay. Danielle?
Yay.
Terry?
Yeah, yes.
Okay, and I vote in favor also of accepting them. So thank you. Thank you. Okay, so any other matters that we should take up today, folks?
Dick, we actually have another action item.
Whoa, that's right. I'm sorry.
We have 2 more action items.
Yeah, okay. First of all right, so take us through number 3, funded program outcomes reporting
Okay,
template.
I'm going to do a screen share on this because I understand not everybody has Excel, and this is an Excel file that was sent. So I'm going to share it so you can see in case you weren't able to review it in the format it was sent. It was kind of a large file, and it was not really conducive to putting into a PDF format how I normally send the meeting documents, even when they're an Excel file printed out to a PDF. But for this one, because it was so large, I couldn't do that. But if you can see the screen here, you'll see a template that this is just an example template, and we've kind of put in some mock outcomes based on things that we, that the Mental Health Board has done to show you how this form would work. But essentially there's 4 tabs. So you have, for each funded agency, you'd have their actual kind of outcomes that they're dictated to track by virtue of their work plans. And for each of those outcomes, you'd have the name of the outcome, the baseline, so what was the starting point prior to being funded, what is the goal, what does success look like, and then what is the progress towards that goal, and then what is the target date for completion. And then in addition to that, then for each quarter, they would need to report on the status towards that goal. So if there's a quantitative component of that, they're actually counting something, they report that part of the progress towards the goal, and then they give us a little update over here, you know, to show, is it something that's not yet started, it's in progress, it's delayed, it's completed, or for some reason it's no longer applicable. And then for each outcome. So just to give you an example, develop an application process. That was something the Mental Health Board did. Prior to the start of the Mental Health Board, there was no application process. The goal was to have funded organizations through an application process, and the progress towards that goal would be that there's now 15 funded programs. And so that is considered complete. And the target date for that was June, and we did meet the goal for that, the target date deadline. So that's the first type of outcomes tracking. Then there are the demographics for the number served. And so similarly to the other one, these categories, these columns on the far left are static, meaning everyone has to report on these overall areas of race, ethnicity, income, geography, disability, gender, identity, language, sexual orientation, religion, and other, to the extent that they track those. We've asked for everyone to send us their intake forms. And then these can be customized for the way that the organizations track their demographics. So we understand that not every organization tracks their demographics the same way, and some of the ways that they're tracking demographics are being dictated by other funding sources and are somewhat hardwired into their current systems and their assessment forms, their intake forms, in some cases even in their technology that they use. So we've allowed for some customization in there in terms of what those specific categories are that are the breakdowns for each one of these broader demographic categories. And so for each of these then on a quarterly basis, they would report the number served in each one of these demographic categories. Then on target populations, we would have them track for each of the 4 target populations, how many total number of clients were served in each one of those target populations, and then an unduplicated total. It should be noted that unduplicated is not a requirement for each of these target population categories, because there actually can be dual diagnosis, in which case you'd have somebody who qualifies under substance use disorder and severe mental illness. But we do want an unduplicated total number served that would only count that person once, even if they were being counted in each category under the target populations. And then lastly, there's an opportunity for some qualitative components, which I think is important for reflection sometimes for understanding things that were successes that weren't initially anticipated and weren't captured in the outcomes that were initially being proposed. And alternatively, the opposite of that, things that maybe were barriers or difficulties that weren't originally captured in the way that the outcomes categories were listed. So for these questions we have, did you find any unexpected positive or negative outcomes from your work? This could include demographic indicators, program indicators, process, things with employees, or other types of stuff. So just as an example, we said for building the learning network, collaborative and coffee hour, it allowed for broader outreach to local organizations while allowing funded organizations to get questions answered in smaller settings. That might be the type of reflection that somebody would have outside of just reporting for their outcomes. Secondly, please describe any goals for your next quarter of work, including how you will incorporate any lessons learned. So how are you going to take these things that you've learned in your first quarter, and how is that going to actually inform your decision making for how you move forward in your program? And then as an optional one, we're asking for some storytelling. So of course, de-identified, nothing that's naming clients, but are there any stories of success that you can share or lessons learned that you can share that would make for some good storytelling opportunities to talk about the success of these programs in the community? And so this form, again, would be customized for each program based on their already agreed upon work plan that dictated their outcomes and their target numbers served, and they would be required to fill this report out on a quarterly basis. And then there would be a year-end report in addition to that.
Could we go back to number 2, the demographics? Okay. So is this data, Jason, going to be picked up sort of automatically from the material for each of the clients?
This would be from the organization's intake forms. So most of them have some type of intake or assessment process in which they're gathering demographic information for their clients. So when they have a client that's being served within a mental health board funded program, they would need to take that demographic information and collect it in a way that they could report the totals to the mental health board.
It's a lot of data, and that, I guess I was just thinking, do we need that on a quarterly basis?
Well, I think most of the programs are being funded at a pretty good amount, and they have many of them a lot of staff involved, and so I think that many of them should have the capacity to do that quarterly. And I think where that helps to do that on a quarterly basis is to get an understanding where demographic groups might be missed. If we find that in aggregate, that out of 15 funded programs, we're seeing that there's a population within Winnebago County that's not being reached, that can be addressed more quickly, that can be addressed kind of at a system level with all of these funded organizations to say, something's going on here and we're not reaching a certain population of the community.
Can I add something here? Would it be feasible to have these people come in every now and then, like 3 of these organizations that we are funding, to come in and talk to us and show us what they have, and not on just this alone, but so they can explain too what they've been doing? I guess I'm looking at it because I want to put eyes on these people, and they should put eyes on us of who's all doing this.
So, well, I would say that the things that, and keep in mind, please, that 14 out of 15 programs have already signed their funding agreements, which dictate the terms. So this was not meant today to be a how we're doing what we're requiring organizations to do, but rather to discuss the template we're using. What we are requiring them to do has already been dictated and agreed upon. The funding agreement does allow for site visits, so that's something that can be requested to go on site. The agreements also mandate quarterly reporting, and the agreements mandate the learning network collaborative participation. I would imagine that if we requested an organization to come in and have a conversation with us, that they would be willing to do that.
I like Terry's idea, though. I see where he's coming from, Jason. The learning network collaboratives, would that be an opportunity for board members to attend those? And that, like as Terry said, put our eyes on the folks and interact with them a little bit. Is that anticipated or not anticipated that we would be a part of those, or is it optional?
It's not anticipated for them to be open meetings, which would allow for two board
That's the issue.
Okay.
I just would like to add that having worked for two funders, United Way and the Community Foundation, I think this is excellent. I think one of the most disappointing things when you are a funder is funding something, assuming that it's going the way it's supposed to, and then finding out at a later date that it's not. And so I think this type of reporting really gives us the opportunity to review what people are actually doing with the money, who they're serving, and how their program is working, instead of being too far down the road and having to ask them to correct it or being surprised because the outcomes are not being achieved.
You're here.
No, I think it's really good. I mean, I don't disagree, Linda. I think it's good stuff. I was just, my question, I was just looking at this one part and hoping that it sort of came automatic from intake.
Mm-hmm.
Because it's, we want people to be doing things with and not be overburdened by reporting to us. That was part of it.
Right.
At the same time, it's finding that balance where there's a completeness to on reporting that does exactly what you described, and that we have ongoing information that says that answers to the question of how they're performing.
Yeah, I agree. And this is a silly question. I'm probably the only one who doesn't understand the geography line item that has these series of ratio numbers. So maybe what do those mean?
These were examples that we created as a mock. And like I said, these can each be customized for organizations. For some organizations, it might be as simple as just being binary. Is this person a resident of Winnebago County or not? Winnebago County, 100%. This particular thing is actually census tract numbers. So I doubt that most organizations, maybe some do zip code, but as an example, we thought it would be fun to put some more idealistic ideas out here on our example sheet. And so this would be census tract numbers. So if there were an organization, for example, that tracked each client by census tract, then you could report it that way, and then you could see a more detailed geographic distribution of clients served by neighborhood.
Got it.
Could be zip code though, and like I said, at the highest level, it would just be binary Winnebago County.
Another good job, Jason.
Yeah, excellent.
Way to go.
We'll have to give credit to Kristen on this as well. She spent a lot of time working on this.
Okay.
It looks very good.
Okay, so we need a vote for this?
Motion to approve?
Yeah, okay, second? Danielle, did I see you? Yes, ma'am. Okay, all right, so, Bill,
Yes.
okay, Terry?
Yes.
Oh,
Yeah.
okay, Linda?
Yes.
And Dick, yes. Okay. All right, so then we go to the number 4, board seat application, matrix and timeline. All right, Jason, how about helping us out here?
So we discussed at the last meeting a process for board member application and review. And I think our kind of consensus that was reached was for Tim to speak to the chairman and then to really get back to us about what the chairman would like in terms of our support. And so then I followed up with Tim and he said the chairman would appreciate a recommendation from the mental health board. And so an application was developed. I sent that out for everyone to review before publishing it. It has now been published. It's gone out in a press release. It's been sent out through the mental health board's email, subscribe to the email subscribers and through social media. We've had some initial response. I think 3 when I last checked yesterday that had applied. So really now the question is more about formalizing the process of taking those applications and determining how to evaluate them and then make that recommendation to the chairman. So I provided an example of what a review process could look like in terms of matrix, similar to how we did the grant applications, to do some initial scoring in the different priority categories that were discussed by the board, and then to maybe use that. The way we did the grant application was after doing the scoring, then there were conversations between board members to discuss that. 2 board members at a time. I think we had a few different meetings with different combinations of board members. And then that kind of culminated into a recommendation to the board for a vote. So we could follow a similar process to that. Or open to doing something different.
Okay.
So if we were to go that route, who would be willing to participate in the review process?
That would be
I'll take a shot at it.
That would be an open meeting, Jason, depending on numbers of us?
So everyone could review and score the matrix independently for the meeting. If we have more than 2 board members, it would be an open meeting. For the grant reviews, we had 5 board members do scoring and then had kind of like a round robin conversations where 2 different combinations of 2 board members met and discussed applications and gave us feedback to then ultimately prepare a recommendation.
That's
So
right.
that's one way to do it. An open meeting is another way to do it.
I like the other way we did it personally, but I'll go with the
And
flow.
this is technically, I think, maybe a personnel matter. I think that might be an exception.
The legal counsel advised that, in their opinion, this did not meet the exception for personnel because the mental health board is not the appointing authority for the position. So
Okay.
it could only be a closed meeting under that exception by the appointing authority.
So I was going to say, ask the lawyer.
I'm
I
willing to-
think that the process, sorry, Bill, worked well for the grants.
I
It
agree.
seems like it did. And I'm willing to participate too, Jason, in that round robin. That sounds like that's a good way to go.
Well, since we only have 5 out of 8 board members, I can send an email out, pending approval of this item that would ask who would like to participate in that. There's really not necessarily a limit on how many board members can participate. The other part of it, though, would be the timeline. So maybe we could include that in this motion. We are set to close the application on the 20th. We got a week behind because I didn't want to put the application and press release out the same week of the special meeting, AKA press conference, to not confuse people with too much information in 1 week. So if this closes on the 20th, that would essentially give us just 2 weeks before the August board meeting. So if the August board meeting were being targeted for vote on this, it would be a pretty quick turnaround. Alternatively, if we wanted a little bit more time to go through the process, we'd probably be looking at September. When I talked to Tim last, there was no specific deadline that we were being, given, but I am sure there's a sense of urgency to get this filled.
I'm wondering if we'd consider extending the deadline in order to, because you said you only have 3, Jason, at this point?
Yeah, there was 3 as of yesterday. We've done some more pushes. I don't know if board members have had the opportunity to push it through any of your networks. We could certainly, as we got closer to the deadline, make that determination, extend it if we're still sitting at, a little
Sure. Sure.
So let me say, alternatively, another thing we could do also is do a Facebook push. We could do that early in next week or even this week. Do a Facebook boost. I think for the survey we spent maybe like $100 pushing it out more directly through a Facebook boost. Another option.
Mhm.
Okay. All right.
Oh, what I heard is the majority, the feeling is among the group that the process that we use for the grants worked well, and we would like to duplicate that with these applications. Is that correct? So could we then and that Jason, one more time, you want the timeline included in this now?
I think we should, if we're going to shoot for the August meeting to have reviews done by then, that we should maybe establish a timeline for reviews that allows for that.
Okay. All right. So it sounds like then we need a motion that would say yes or no to the process that we used for the grants. We would use a similar process for applications for board membership, and that we will do that in a manner and time frame that allows us to vote on this in our August meeting. Could I have a motion to that effect?
Motion.
All right, Terry.
Second?
Okay, Bill and Bill seconded. Okay, so
I have a question.
yes,
So
ma'am.
looking at the calendar, if we extend the deadline, we would only, I don't know that you would be able to extend it even an entire week if we were going to vote on this at the August meeting. So the 20th is 2 weeks from yesterday. So I think you would really want a week at least for people to review, and then if we're going to have small discussions. So I don't know what you feel about that, Jason.
Yeah, I guess that's kind of what I was trying to imply, is that it's a really fast turnaround time to everyone to score them. You know, if we only have 5 to 10 applications, maybe it's not too big of a load, but, you know, in terms of board member availability capacity, we're right now, it would be 2 weeks to the board meeting itself. I mean, that's not even having it done a couple days in advance. So, is there comfort with not voting on it until September? Does that seem like that would be too far out?
I think that's too far.
Yeah.
Because you're coming up then on the funding, you know, the budgeting cycle.
Yeah.
And you need somebody, I think, on board. You need another person there to give input.
There's no reason why we can't call a special meeting in the middle of August to do this?
Yeah, we could do that.
So it looks like the following meeting would be September 1st, which would give you, I mean, they're still not going to be seated until the September meeting. But that way they could be at the September meeting.
Well, and just, I mean, they're not likely going to be seated at the September meeting. The mental health board is making a recommendation to the chairman of the county board, who's the appointing authority for the position. So it's not going to be, once the mental health board votes on who they're recommending, now the seat is filled, it still has to go through additional procedural things. So either way, you know, even if it were voted on in August, it may not happen before the budget is approved for the next fiscal year.
I like your
That's
idea.
my understanding of the procedure.
I like your idea, Linda. The one thing that strikes me is the ability to do this by August is a little dependent on the numbers of applications. I mean, to me, it would be very disappointing if there were only 3. If there were, that doesn't seem like too heavy of a load to be done. But what if by July 20th, there are 6 or 8 or 10? That might make it just a bit more difficult, in which case your scenario of a special meeting
Makes sense.
would make sense. But what do we do, Jason, if we approve a motion like this right now, and then we get closer to the 20th and we need to amend the timeline? We cannot as a board, we can't do that electronically, can we?
No, so I think we need to create a condition in which if by July 20th, there's a certain threshold of applications that have been received, the board will enter a review process using the attached matrix to provide a recommendation at the August meeting. And if the threshold of applications is not met, there will be an extension of the deadline, in which case a special meeting would then be scheduled that could be, the date of which could be dictated at the August board meeting.
That sounds like a motion. What great word.
What's the threshold at which
Yeah.
the comfort level is there? That's the fill in the blank. Are we looking for
Do we want 10?
10 to be the cutoff?
Yeah,
No idea what to expect.
right, correct.
3's disappointing, but I have no idea in the next 2 weeks. As Linda points out, it's 2 weeks from yesterday. Gee,
Yeah.
we're going to get another 6, 8 more, 10 in 2 weeks. I don't know.
Well, if there's any learning in how the grant process played out, I think 90% of them came in the last week. So
Yeah.
sometimes a deadline does help to get things, submitted. People wait till the last week.
Seems
All
pretty.
Okay. This is
To me, 10 seems like a lot to me. It's a pretty important decision too.
Well, some of it depends on, I think maybe the board might consider soliciting some applications. I certainly I called somebody and said, I urge you to apply. Look at who's on our board and who isn't represented. That might be something to, what are the gaps in who we are as a board? And see who in your circle, who you would like to, who you think would have something to add. I don't see anyone in the Hispanic community on the board. Personally, I don't really know anybody, but you guys have a much broader range of experience than I do. I don't see any people from the Asian community. While I think we're pretty well represented in this, boys and girls kind of thing. Except for Danielle, I think we're all we skew older. Just things to think about. just things to think about who we might want to reach out to.
Agreed.
Yeah, I'm not sure that we have diversity of sexual orientation either.
That too. Although I haven't asked anybody.
I know, and
these are definitely things that I think we as a board, my other board experiences have included, before you go off a board, you have to replace yourself kind of thing. So just something to think about.
I agree with you, Wendy, that I think that this board should take the lead on wanting as much inclusion and diversity as possible. And so the only way to do that is to be very, very deliberate about it.
Yeah.
Agree completely.
I'll be honest with you guys. I've been going back and forth in my mind. I was asked to be on the board. I said, I think somebody else needs to be on the board besides me. There's nothing magical about the board seat. But those are just things I'd ask you to think about.
Okay, well, I need some help in solving this timeline piece.
Okay, I'm gonna sign off, guys. See you all. Good luck.
Yeah, who was that? Terry's?
Yes, Terry's motion. Terry, do you want to
Yeah, so if Terry withdrew it.
withdraw your motion? If you would. Okay, so Terry's willing to pull back and withdraw his motion.
Withdraw my second.
Okay. So we have a blank sheet again. So the one thing that we have agreement on is that we would like to use the process. We would like to use the process with the grant applications. That part we're comfortable with now. Help me with how do we want to decide this thing on timing?
So, yeah, I'm wondering if we can do two separate motions, and
all right.
I'm wondering if we could do two separate motions. So one of them would be to do it the way we did the grant applications, to review them that way and according to the matrix. And then I'm wondering if we would be able to have the timeline to be determined according to how many applications are in by July 20th. And that this is kind of a dumb question. Do we have an executive board of this board, correct?
No.
We don't?
No.
Okay. And there's not one in the bylaws then? The officers?
It's correct.
Okay.
There are officers dictated by the bylaws, but there are not any subcommittees dictated by the bylaws.
Okay.
The ability to create a subcommittee.
Okay. Well, because I was just going to say, because, I would be I'm fine if it's, if as we count the number of applications that come in by July 20th, if our president and vice president are not satisfied with that amount of applications, then we determine, or then we extend it for a week and extend consideration. I don't know.
After completion of the evaluation process, if it's determined that there are not are we making a recommendation of one person or 2 or 3 people? So sure, I guess that's the other question.
I think what if you said if it's determined that there are an insufficient amount of applicants, we will extend the deadline. Can we just say that? Do we have to say when we're going to vote on it right now?
I don't see why we would have to say that.
And do we have to define insufficient? I mean,
Yeah, the other route,
I'm sorry, Bill, you could have 10 excellent candidates or you could have 20 mediocre ones.
Right.
to me,
So-
we could pick a number out of the air, but, which I don't know how effective that is either, but to somehow objectify this, I was only thinking of the difference between July 20th and the August board meeting. If there are X number of applications which exceeds 3, it could just be from a work and a carefully review of those. It could be a tougher time frame to meet by that meeting in August. So I like your idea, Linda, of the separating the motions, approve the matrix, approve the process. And the second one would be a conditional, kind of what Jason said, some sort of condition under which we would consider, I think you had said, a extension of the timeline with the ability to call a special meeting in August. Wendy made some good points about delaying too long as it relates to the ongoing work of our next cycle, and you don't want to wait too terribly long either. So I thought that was a good point. And, even as I suggest pulling a number out of the air, it seems a little silly, but I'm just trying to figure out how we make this objective.
Might I recommend, based on what I've heard, that we do the review of how many ever applications are received by July 20th, and that if upon review of those using the established process, it's determined that there are not at least one qualified candidate, to make a recommendation to the chairman at the August meeting, that you could then discuss reopening the application for a new period of time. And then you really don't have to dictate those specifics today. You can just see what comes forth.
I like that. So you would, as the close of the 20th, you would review however many came in, score who came in, and we at that point determine that there is not perhaps an agreed upon qualified candidate. Is that what you're saying, Jason?
Yeah, so at the August meeting, there's either recommendation of here's one or more candidates that would be recommended to the chairman, or we have not identified qualified candidates and therefore need to reopen the application process. Which could be its own action item on the August meeting agenda.
Do we have a threshold, a numeric threshold? If I remember your categories, they were 1, 3, and 5 points on the point scoring scale.
The 1, 3, and 5 was how we did the grant application, and there were really just three areas, and then the 2 and 4 were like they fall in between those categories. That's how the grants were done, and there were I can't remember on the grant process if there were 4 categories, I think, for each one that went 1 through 5. So each one totaled to a score of 20, with 5 board members added up to a possible score of 100.
Yeah.
So on the board nominations, how do we determine which numeric threshold equals a quality candidate?
Well, I think that we used that as a frame of reference then for conversation. It wasn't like a final decision based on the
Correct.
number. I think it was just a way to frame conversation. And then really the conversations were what ultimately got into the details of what needed to, what the recommendations would be.
Right.
The conversations were critical in that process. It was not just on the basis of a number.
Yeah.
Right,
Absolutely. It can't, it won't be just a numerical.
right. We didn't just take the numbers and line them up and say, this is,
Right.
they're
Correct.
funded, they're not funded.
That's right.
Yeah, no, I remember that from the process. I'm just thinking in this process, if a motion is suggesting that there are or are not qualified candidates to bring forward to the August meeting, it still strikes me there's some objectivity around the scoring, even if they're, but they're also assuming there will have been conversation by the August board meeting. Is that correct?
Correct.
Okay.
Yeah.
Okay. Got it.
And the other piece that's in this is just the discussion we just had in terms of like if we have 3 applicants, we talked about that we're looking for, and for particularly some people that fit that, and so that's another. It seems to me by the 20th, that becomes a determinant also. Like, do we, just as an example, do we have an Hispanic person that we can look at in for potential board kind of thing, or one of the other criteria that has been mentioned this afternoon. That to me is also part of it. The larger the number, obviously, the more options we have in terms of for the chairman.
Well, maybe Jason's idea is the best then to move forward. I wonder if July 20th is in, and all of us who can review and score, and there are conversations. I think what Linda was getting at was we don't really have an executive committee, but we have Mary Ann and Dick who are our leadership, and there is a determination based on then Jason's having a series of one-off conversations with us that reaches a consensus that we have qualified applicants or we don't.
Mhm.
Right.
I'm just trying to talk at it.
Yeah, no, keep going. That's a good thing.
I don't know. I was trying to talk through because it's
Yeah,
kind of not that simple.
yeah, correct. Why don't we we'll do one, we'll make one. I'm going to go
Yeah,
back.
so I'll make the motion that we use a similar process to our grant review process with the attached matrix to review new member applications.
Is there a second to that? Bill?
Second. Yep.
Okay, all right. All right, so then let's vote on that. So Bill, yes or no?
Aye. Yes.
Okay, Terry?
Yes.
Okay, Danielle?
Yes.
Okay, and Linda?
Yes.
And Dick, yes. Okay, now,
The tricky part.
I think I've got the tricky part figured out.
all right, okay, throw it to us, buddy. Throw it
Okay.
to us.
Board application will close on July 20th. Any number of volunteer board members who are wishing to participate in the review process will need to score on the matrix by July 25th, and that the in-person conversations will happen July 26th through July 30th for a recommendation to be made to the board at the August 4th meeting. The recommendation, of course, could be a person, or it could be that there's not a qualified candidate.
So moved?
Moving on. Yep.
Terry, you're gonna second that? Did I say-
Sure, put me in.
All right, okay. All right. So, Jason, you want to try it one more time and then we'll do our vote.
Okay, so whereas,
Yeah.
whereas the application closes on July 20th and the volunteer board members score using the matrix applications from July 21st to July 25th, and that in-person conversations take place from July 26th to July 30th for an ultimate recommendation to the full board on August 4th.
Okay. All right. So that's where we are. So, and that's been our motion. So Bill,
Yes.
okay, Terry,
Yes.
okay, Danielle.
Yeah.
Linda,
Yes.
and as I understand it, yes. Okay. All right. Great.
Okay?
Okay. Thank you.
Thank you, Jason.
Oh, okay, so that should, folks, be it in terms of, unless we have other matters that we need to discuss.
You know, I hate to say it, Dick, but I don't think, this wouldn't delay, I don't think, did that meeting minutes motion include the special meeting or just the, I just don't remember. It's
No.
been,
It did
Oh,
not
yeah.
include the special it took us to a point where our recommendation would be made to the board on August 4th.
no, I'm talking about the original meeting minutes,
Oh, I'm sorry.
the June 2nd meeting, and then the, which I apologize for missing, but the special meeting news conference.
Yeah.
Right. I don't think we approved the minutes of the second meeting,
I don't think we did either.
the second set of minutes.
Really? Okay. All right. And then I apologize for not making it clear. Okay. So what we're really then talking about are the minutes for June. Which one did we?
June 25th.
Yeah, we
Right. We
approved,
need to approve the minutes for June 25th.
yeah, we
Okay.
approved June 2nd.
Yeah, okay. There we go. Okay. Thank you. And thank you for remembering. Okay.
He's on vacation. He's not thinking about anything else.
Yeah, sometimes the brain clicks in and sometimes it doesn't.
Yeah.
Linda, he's not on vacation. He's
Oh,
retired.
I'm sorry. He's retired. He's not thinking about anything
That's
else.
right. He's relocated is all he's
It's
doing.
just words. They're just words. It's semantics.
Huh?
All right. Do I have a motion to accept the minutes of our meeting Friday, June 25th?
Motion.
All right, Terry, thank you. All right, and we have a second for that?
I second it.
Okay, thank you, Linda. All right, so then, Bill,
Yes.
approve for the minutes, okay, Terry?
Yes.
All right, Danielle?
Yeah.
Okay, and Linda?
Yes.
And Dick, yes. Okay. And we had one question that we had, Jason. Are we making now public, or is it part of our website that the amount of money that we are granting to each of these agencies?
We have one final funding agreement that is pending. And as soon as that is signed, we will add a disclosure statement to the website that lists the amount for each funded program.
Okay. All right. Okay. All right. Thank you. All right. So then, could I have a motion for adjournment?
Yes.
Terry?
Yes.
Yeah. All right. So all right. So Bill? Yeah. Yay or
Yes.
nay? All right,
Yay.
Terry?
Yes.
Okay, Danielle?
Yeah.
Okay, Linda
Yes.
and Dick, yes. Jason, you've done an excellent job again, man. Thank you, thank you, thank you for helping us.
Dick,
Thanks,
you did an excellent job also. Thank you.
Indeed. You're
Thank you.
stepping in, Dick.
Thank you, thank you, thank you.
Thank you.
All right, folks. Having the rest of a good day. All right.
Thanks,
And
everybody.
Bill, enjoy
Bye,
yourself on
everybody.
the islands.
See you all soon.
Hey, Bill.
Yeah.
I just want to tell you, Tom really, really appreciated your recommendation for a doctor.
Oh, good. Good.
Okay.
I like
Very,
them a lot.
very much.